What natural supplements are most effective at lowering cholesterol? I'm Naturopathic Dr. Elie Klein, and I help middle and older aged adults with cardiovascular disease and diabetes turn their health around naturally. And so if you're interested in this topic, you were told probably by a doctor that you need to lower your cholesterol. Maybe you haven't gone on medications yet. Maybe you have. Either way, you're probably concerned about side effects, and that's why you want to go natural. And indeed, long-term use of cholesterol-lowering medications can cause a variety of different side effects. These can range from fatigue to muscle and joint pain and weakness and achiness, increase in blood sugar levels and increased risk for diabetes. It can affect mental health, can affect the mind, the mood, can contribute to forgetfulness, irritation, to short-term memory loss. It can also affect the organs, the liver and the kidneys and so on. And so I'm not saying here, don't take those medications. This is between you and your doctor. I'm here just to provide information. And if you are concerned about such side effects, then that's why you're probably here. So let's talk about the 5 most effective supplements, at least according to the current scientific literature. There may be others as well, which perhaps are more obscure, but I'm going to go now with the most popular ones, the ones that are most studied. So let's start with number 1. And number 1 is niacin. Niacin is a type of vitamin B3. And most doctors are probably familiar with niacin. It's actually in the medical Bible, the Merck manual, along with all other types of medications for cholesterol. And basically between 1 gram and 3 grams per day, it can decrease cholesterol by anywhere between 15 to 25%. Compare that with cholesterol-lowering medications like atorvastatin or rovastatin, which when given at dosages of between 5 milligrams to up to 80 milligrams can lower cholesterol anywhere between 25 to 55%. So it's not as potent, nor are any of the other natural substances that I want to share with you. Decrease of between 15 to 25% is still quite substantial. Having said that, I've never recommended niacin or this type of vitamin B3 niacin. There's another one, and I'll talk about it in a moment, but I've never recommended it because it can cause very uncomfortable side effects. Niacin releases histamine, which is the molecule associated with allergies. It can release molecules associated with inflammation, and as a result of that, it can cause flushing of the skin, warming up the skin, heat, itchiness, a lot of discomfort. That type of reaction to niacin at that particular dose is called the niacin flush. Now, we do need 20-25 milligrams of vitamin B3 every day, and so an amount of between 1 and 3 grams is a lot higher than that. And so at that high of a dose with those types of uncomfortable side effects, particularly because they're associated with molecules that are associated with allergies and inflammation, I'm not super comfortable at recommending niacin. There's another reason I'm not super comfortable recommending this or others, and I'll explain that later on. But the other concern with niacin is that it can also cause some degree of liver damage and increase in liver enzymes. So liver function has to be monitored while taking niacin. So it should be done under the supervision of your healthcare practitioner. Having said that, taking niacin for a short period of time is probably not all that bad, even with these types of uncomfortable side effects. And I'm told, I've never had a whole lot of experience with niacin personally, but I'm told that after a period of time, those symptoms subside. Anyhow, let's move on to the next one. And the next one is an interesting one because it's the natural inspiration to the cholesterol-lowering medications, the most common class of cholesterol-lowering medications known as statin drugs. And so it is red rice yeast. A substance in red rice yeast called monacolin K is actually the actual inspiration to the cholesterol-lowering medications, and in essence, it resembles very closely the shape, the structure of the most commonly prescribed class of cholesterol-lowering medications, again, the statin drugs. So at a dose of between 1200 to 2400 milligrams, red rice yeast can affect a decrease in cholesterol of anywhere between 10 to 30%, which again isn't perhaps as powerful as the cholesterol-lowering medications, which can lower cholesterol by up to 55%, but it's still quite significant decrease in cholesterol. It is fairly safe, except that according to one Italian study, 10% of the people who use it do experience muscle pain, which is a similar side effect to the conventional cholesterol-lowering medications. Having said that, short-term use of red rice yeast is probably not an issue. The next three substances lower cholesterol by a lower amount, but they're safer in general. And so that's why I like them, and they can be combined to perhaps produce a more significant effect. So number 3 on this list is good old garlic. And studies show that at 400 milligrams, garlic, through the active ingredient allicin, can produce a reduction in cholesterol of between 5 to 15%. Fairly safe, fairly easy, and probably a good solution. Number 4 on the list are the plant sterols. Plant sterols, in essence, are substances that resemble the shape and the structure of cholesterol. So in a way, these are plant cholesterol or cholesterols. And the way they work has to do with the fact that we get rid of cholesterol by eliminating it gastrointestinally. So every day, a small amount of cholesterol is removed through the intestines when we go to the bathroom. However, a portion of the cholesterol that it goes down and is flushed out through the intestines is reabsorbed back into the system, into the body, into the circulation. It is believed that plant sterols work by competing with cholesterol for absorption because they look similar, they resemble cholesterol, they prevent cholesterol from being reabsorbed. And so that's how plant sterols are believed to lower cholesterol. The daily dose for plant sterols is between 1.5 to 3 grams per day, and they can decrease cholesterol by a range of between 10 and 15%. Again, not too bad. And last on the list, perhaps the most common type of supplement, which is fiber. So be it psyllium fiber or oat bran or just regular oats, rolled oats, or any other type of dietary fiber can also decrease cholesterol, but still by a lower amount of between 2.5 and 5%. Having said all of that, I'm not so sure that lowering cholesterol is the way to go if you want to prevent a heart attack or a stroke. Sounds crazy, doesn't it? What do I mean by that? Doctors are always worried about cholesterol levels because cholesterol is a risk factor for cardiovascular disease, for heart attacks and strokes, isn't it? Well, there are several studies out in the medical and scientific literature that suggest that at least half of the people who have a heart attack or a stroke don't have high cholesterol. They have normal or low cholesterol. So what does that say about the role of cholesterol in causing a heart attack or a stroke? I'll talk more about this in a different video. But I just want to wrap things up by suggesting what are the sort of things that I'm interested in, what kind of tests I'm interested in order to determine whether a patient is at high risk or at a low risk for a cardiovascular event, for a heart attack or a stroke. If cholesterol isn't that great of a marker meaning a chemical or molecule in the blood or in the urine, what other markers might be better, more viable, more telling about the degree of risk of a patient, a given patient? And so I'll give you 3 of my favorite markers for determining whether someone is at high risk or not for cardiovascular disease. Number one is the marker of inflammation. It is well known that inflammation is closely associated with the clogging up of the arteries, with occlusion, with blockages, and with heart attacks and strokes. And so one of those markers, there are several, but perhaps the best one is C-reactive protein, and particularly high sensitivity C-reactive protein. It's a type of protein that is made by the liver and is spilled into the blood in times of inflammation. And high sensitivity C-reactive protein is very sensitive to the degree of risk of cardiovascular disease and a cardiovascular event. And it tells you whether the arteries are getting clogged up or not. The next marker is a marker of coagulation, of clotting, the formation of blood clots, right? And blood clots can contribute to a heart attack or a stroke. And so the marker is fibrinogen. Fibrinogen is involved in plaque formation, and high levels are associated with increased risk for a cardiovascular event. Lastly, there is a urine marker, which I really like, and it kind of tells me what direction is the patient going in. Are the patient's blood vessels in good shape, or are they compromised because of cardiovascular disease? And so it's actually a kidney marker, first and foremost, but it's also a marker for what's called endothelial dysfunction. Endothelium being the lining of the arteries, so dysfunction of the lining of the arteries. The reason being is that the kidneys are highly vascular. And if the kidneys are leaking excess protein, then it's a sign that the vasculature, the blood vessels, are compromised. So this particular test is a test for the ratio of two different proteins, albumin and creatinine. And if the ratio of albumin to creatinine is high, then it's a clear sign that the health of the blood vessels is compromised. Hopefully you found this video beneficial. If you'd like to learn more, then watch other videos on this channel. If you're watching it on YouTube, subscribe to the channel. And if you'd like to take the guesswork out of your specific health situation, then reach out for a chat and let's see if it would make sense for us to work together through my website, www.drkleinhealth.com. Take care.